Hello everyone, welcome to another video of Pigment Show with the professionals. And today we have Renish sir to the show. I welcome Renish sir to the show.
Hello. Hello.
Okay, so I'm giving opportunity to the guest to introduce yourself.
Myself, I am Renish Lawrence, Assistant Nursing Superintendent in a reputed institution under Government of India, and I basically belong to Kerala. I have completed my education in South India itself, in Tamil Nadu, in Madurai, and after my graduation, I started working in Tamil Nadu itself, and later I transferred my job to Kerala, and I was been working for 5 to 6 years in Kerala. Later, I got a job under Ministry of Health and Family Welfare, and I am presently in this current area. In my family, I have a wife and 2 children, and parents, father and mother. They are living in Kerala itself, and personally here, my wife and kids are there, and they are in nursery and in UKG. That's about me and my family. And I have been working in this place for the past 10 years. In this institute, it's a good opportunity that is given by God. And also, I take this opportunity to specially thank the Picment Studio for giving this opportunity. And also, I thank God for making me and providing this opportunity to speak or share a few words about me and my profession. Thank you.
Okay, so you have done your college days from actually Madurai.
Yes.
So could you recall some of the things from Madurai, how it is like?
Yeah,
The college days especially.
the college days, I think that will be the nostalgic feeling for each and everyone, because once we were in the college days, we are not able to realize what is happening. Once we come out of these college days, and when we uh, go into our later young stage, or when we are working places, then only we will realize that how wonderful and how beautiful it was.
Okay, so it was really beautiful experience with your
Yeah, it was
college
very
days.
beautiful days.
Any fun time that you could recall and tell to the viewers on that time, college time, or it is all the day there would be some fun and all the things.
Actually, our college was very strict college. They will not allow us to even to go outside the campus. Only we were allowed to go to outside the outside the gate only for 2 hours in the weekends. Only on
Okay.
Saturday and Sunday we will be permitted to go 3 hours of outing. That was only allowed that for
So no movies, no parties. Like
yeah, we used to have. Actually, in that time, in that 3 hours, we used to go for movie or like that. We used to have, and usually the food, the outside food, that is very wonderful. Especially in Madurai, we used to get that jigardanda and this murgan idli and variety of foods.
What about the masala dosha of
Masala dosa is also fine, because nowadays I'm not able to get this food frequently, so I am missing all this food.
Okay. So your current position as a nursing administrator in trauma and emergency department. So how is your feeling about that actually?
Actually, now I have become in an administrative post for the past 1 year only. So I have been coming from the grassroots level of nursing care. So for few years I was being in the college, nursing college. So I was being in the education field also.
Okay.
So
So you have previous experience in the college as well, I think, in the private institution like King's.
yeah, I had a
So you have started your journey as a, as a nursing educator, like.
no, I started my journey as a operation theatre nurse only. After my education, I was being posted.
Is it the same department, trauma and emergency, in that time? Or?
No, that was on a regular OT.
Okay.
So
General OT.
General
Right.
OT.
Okay.
So I was been working for 1 year there. Then later, I was being posted in my college itself for 1 more year in an outreach center that is in Rameshwaram. That was in different. I was a project coordinator. They was being tasked me for a special project for developing the skills and to educate the kids those are not able to read and write. So
Okay.
we have to identify what is the nursing care needed for these type of children. So we were being posted in that special project for 1 year.
Okay.
Then later I got a job in
Could you
Kerala.
tell some more experience regarding that particular project?
Yeah, that was the thing that there were many kids. There was an organization under CSI. They was running an institution.
Okay.
So actually, the children, they were not able to do the basics skills. That
Okay.
means they were not able to wear the clothes, or they were not able to take care of the food.
Okay.
So we have to provide them each and every care.
Is it like some children like autistic or?
Not only autistic, it
Okay. So
almost
it's a combination of
a combination of the children. Actually, the thing
and some
is that
children have learning disorders as well. I think.
everything is there. Actually, we were posted in the outreach center, and we have to go into the interior community area, and we have to identify that any children is there.
Having that disability or
Disabilities.
something like that.
So actually, the thing is that in 3 or 4 years, the parents is not at all aware that they are having this type of disabilities.
Disabilities. Okay.
So actually, there will be mainly they are fishermen people, and they used to go to the sea in the morning, and by evening or after 2 days only the parents, mainly the father, used to come.
And so they don't have that much time to observe the kids.
They have the observation. The thing is that they were not
aware of.
They know that they're having some problem, but there was no proper institution or where to take care or how it can be rectified. They were not having this knowledge. I'm talking about nearly this past more than 14 years before
Yeah,
that time.
14 years ago. This experience. All
Yeah.
right.
So
But at that time, you have done a very responsible job.
yeah.
Having that much.
That was allotted from my college itself. We 2 people were selected out of 60 students. That was a special project on the interest of our.
So at that time
PhD.
itself, you have the experience to work in a team like that.
Yeah. It was a very good opportunity.
Okay. Okay, and coming to your present position, like after that, after that time.
After that, I came to Kerala, and I was working in KIMS, that is known as Kerala Institute of Medical Sciences. That was also one of the reputed institution where I have been getting the knowledge, and I have able to shine myself and realize that who am I. Okay. So they have been giving many responsibilities. Actually, I am a very lazy in nature. I don't like to do anything or initiate anything to do myself. Okay. But if somebody gives me any responsibility, I used to take, and I used to, I took that as a responsible, and I used to complete that task.
Okay.
So after
that was a challenging thing, actually, right at that time.
Yeah. Actually, when I say I was the only male person in that College of Nursing, so they were giving me much responsibility, especially the works that will be done with the university. So the university was in Thrissur, so I have to travel to that area. Okay. Many of the times, the principal will be giving authorization letter that I am being sending for this conference.
Because I think you are the representative of Student Nurses Association, like all the things which need to be carried out on events like cultural meet and sports.
Yes, not only regarding the students meet, each and everything that as an administrator who has to run a college, all the basic needs, what are the documents that has to be completed, what are the requirements provided by the INC, what are the clinical rotations, what are all the things, even many of the even.
So where you will get the provision, like whether you have got the provision to get advice from some of the pioneers in that area, or?
Yes, actually, I had a thing that I used to learn from each and every one. Whoever is doing some new work, I used to go and observe, and I used to get it. And the thing is that I have learned many things.
Okay.
The thing is that even when I was working as a clinical instructor, many of the newly freshly joined MSc people, they used to come and ask me how to make a clinical rotation, how to make a master rotation. So even after reaching to the government institution also, I used to guide them how to put and what are the protocols that to be followed. They used to refer, that is the thing that is happening.
So you have got a regular experience as a facilitator and also an advisor, right?
Yes, actually they used to give some of the job delegation. When I was not aware what to be done, then I used to go and ask to some of the senior people how to be done. So I got many of the knowledge like that.
Okay.
And that knowledge I has to be implemented to other people.
Okay. All right. And going on? Yeah.
Yeah, then Later, I was been working. I was been in KIMS for 1 year. Then I later joined to School of Medical Education run by MG University. That is a government institution, but it is a self-financing institution by MG University, and it's under government of Kerala. So I was been there for almost 4 years. I was been, that is in my native
Same
place
job
itself.
title with the same.
Same job title, and that was in my native place itself. There also, the thing is that our college and the higher center is in Kottayam. That is almost 5 hours we have to travel. So for each and every work that has to be carried, we have to go to Kottayam. So there also, I have been many times. I have been awarded the job responsibility or the principal. They used to, for any conference or for any meeting, they will be sending. They have been selected. So that also was an opportunity to attend meetings and learn many things, because of the for a person who is in the rank of professor rank only used to get these type of opportunities. So I was being blessed, and many of the national conferences I was been attending in CMC Velu. So all the principals from all the South India, they will be attending. So I have.
So it's a wide variety of experience, right?
I had a very wide.
Really fabulous, right?
Yeah.
Awesome experience with that. Okay, so in the southern side, you are executing this much duties, and you have got delegated with this much interesting tasks and all these things. How come? So, what is the one factor that pulled you up to move from South India to North India?
Actually, because I got a government job, I probably I preferred I should have, because the
job security.
Job security is the thing. That was also, it was not a permanent job, and also so I decided to join. And even that time also the remuneration also was very less when comparing to the government sector. So I preferred and I moved to this place.
It was, I think, it was almost 12 years ago, right? 11, 12 years ago that you have worked as.
It's maybe almost
10 years.
10 years I have been moved to this job. And after reaching here also, I was been in College of Nursing for a few years. And there also I was able to execute the same job responsibilities. And later I was being posted to ward, and for a few months I was being the ortho ward. I was being working there.
So what is your experience over there? How so? Is it okay, like when somebody is working for a long time in the education sector and then suddenly a role change to the clinical sector?
Actually, when I was working in the education sector, I was able to visualize all the things, practical things that I was able to visualize, but I am not able to work, or practically I am not able to undergo all these steps.
So you have got an opportunity with that posting.
By this posting, I was, what all I have teach to the students, or what all things that has been learned, that has been, I myself, I'm going through that stage or doing that task. While doing only, we will be able to feel that or know that what is the actual.
That's a practical experience.
Whenever we are, whenever seeing that job, will not be they will be seeing that if you have to pick a patient having a 100 kilos weight, 2-3 persons will easily lift. When we go and lift only, we will feel that pain. So for each and every work, there is a effort is there, something to be done. So these things
to make you perfect with the ongoing job like that.
Whenever
to make
we
you perfect
do only, we will be
and an expert. So the practical experience is very, very necessary, of course. Right. And after the ortho posting?
Then then next I was being put in a minor operation theatre. I started learning again from the thing that I have been learned in the initial stage of my.
So in the minor operation theatre, it should be like the cases will be under local.
Not only local, they
minor cases.
Minor cases, and the LSCS cases, cesarean cases have also been going there. And weekly one day they will be having a anesthesia team will be
so
there.
Somebody needs to work in OT if they have been posted on minor OT and then move to major OT. Is there any?
All the steps and everything will be same only. There is only difference in the mode of anesthesia and the risk factors, that is in minor cases that is very less, in major cases. But in all the sterile techniques and what all the things, what the protocols, that is the same.
Policies and protocols
everything is same only.
And everything need to be systematic in operation theatre,
Yes,
of course. All right. So you have experience in minor OT first? Then?
Yes, then I have been working for in minor OT, and after 1 year I have been transferred to the major OT.
Okay.
And initially it was being 3 OT is been functioning. That was modular OT. There is some difference between modular OT and the normal OT. The modular
So
OT.
for the viewers, could you explain the difference between?
Yeah, the modular OT is mainly nowadays it is a type of hybrid OT. That will be the all the operation theater will be covered with lead covering.
Okay.
Previously it will not be lead covered. It will be almost all the panels and the switches, everything will be inbuilt inside that. The OT light will be fixed in that itself. Previously they used to have a portable light. Nowadays it will be fixed, and they'll be having a camera system that can be doing the recording.
Yeah, so you said like the lead covering on modular OT. So what is the purpose of that? Actually?
That is for mainly for preventing the
Radiation from CR machines.
CR machines and like this.
Okay.
And one more thing is that the system of HEPA filter. Actually, the circulating air will be the inflow of air. There is a HEPA filter system is installed, and the filters will be having covered oval from the top portion.
Okay.
So the airflow will be inside the OT in a circular mode. In 1 minute, it will be 30 cycles. It will be rotating. The air will be moving out. So the purification is also taking place. So actually,
so how it can purify?
The air is moving out.
Moving out.
In 1 minute, almost.
So the HEPA filter, the filter will absorb the air like that.
The air will be the fresh air will be coming through the HEPA filter, and it is coming to the OT, and it will be the filters will be cleaning all the microorganism, minute even the minute.
So the airflow will be strictly through the HEPA filter.
Yeah,
like
it will be.
It
will be coming through the AC, and this air will
so
be
is
coming.
it inbuilt in AC or it is different?
It is a centralized AC, but at the end portion of the operation theater, they will be having a HEPA filter, and the air will be coming inside, and
so
there will be
it will ensure always fresh air and free of microorganisms.
Free of microorganism. And one more thing is that the paint that is having inside the OT, that will be a antimicrobial paint.
Is it only antimicrobial or it is like antifungal also?
Yeah, both.
It should be
including both.
Including both. Okay, so the main purpose of that paint is to, sometimes if there is a wet surface in the wall or something like that, there is high chance to get the fungus and all these things like that. So by this painting, it could be also.
And also
so these are the features of the modular OT line.
Yeah, and also it's easy for cleaning also.
Okay.
And also the rate of fumigation rate is there is no need of fumigating all the time.
All the time, because already there is fresh air delivery and circulation and all this.
Weekly once, so that is only they have been recommending for the.
Okay, so you have experience working in a modular OT and also a normal OT.
Yeah.
So in normal OT, these are the disadvantages. We need to regularly fumigate daily, and also the light wouldn't be like there wouldn't be the operation theater light wouldn't be fixed. Like we have a portable light, and we need to adjust like that.
Yeah.
Right. Okay.
And the construction of a modular OT is much costlier than comparing to a normal.
But its advantages also is very because we can give a quality and standard care in the operation theater like that.
Yes.
Right. Okay, and what else?
Then talking about as a leader, what are my jobs?
Yeah, as a nursing administrator, that is a big factor actually.
Actually, when we talk about an emergency case or an emergency OT, it will be working for 24/7.
Okay.
Actually, the cases will be coming in every shift. We cannot say that only one shift the case will be there. 24/7 the case will be there. The thing is that there will be some type of prioritization, what type of case to be happen.
So triage, right? It's a type of triage.
It's a type of triage. There is the types
we need to
of
prioritize the cases.
Yeah, almost everything will be emergency.
Okay.
But in that emergency, which case has to be taken first, or which is the most priority?
Okay.
And there will be some cases will be there. That is damage control surgeries will be there. I think that is a new word for you.
Yeah.
Damage control. Damage control means that is actually it has been taken from by US Navy, this word for damage control.
Okay.
Suppose if they are going through a ship, something happened to the ship, what they will do first.
Okay.
So from that basic, they have been taken implemented to these operations also.
So something happens in the ship, like damage control.
Yeah.
So there is a protocol in the ship, like what's the thing needs to be done first.
Basically, what is that damage control means? How to save our life.
Okay.
That's the thing. So if
So how it could be implemented on the same situation in
the
Autism?
same situation is that they can do some remedial measures for sailing to some more area or to the nearest port,
Okay.
or call for help from someone else. So
Okay.
like that, they have been identify some of the protocol. That means for saving a patient's life, what are the things that has to be identified,
Okay.
and for preventing the death. The main thing is to prevent the death.
Okay.
Somehow or in a way, we have to prevent the death. The main thing is that when we talk about the operation theater, first thing that will come about the sterility.
Yeah. First, obviously, it is common to all.
It's the common. It's the common factor, and even the people working, the nursing people working in the ward, they even fear to enter into the operation theater. It's the operation theater they will be having.
Of course, there is a
it's operation
protocol. Like
theatre.
if you're entering inside the operation theater, you need to follow with certain protocol, right?
The major problem in emergency OT is that we will be facing that the time will not be having the time. In 2 to 3 seconds, the patient may die.
Okay.
So the types of situation we will be getting. And the thing is, as first as emergency, we have to enter the patient into the operation table.
So there was a question over there, like if the time is that much limited, so whether you could implement the factor of infection control there, or implement the factor of emergency there.
That's a very wonderful question. When we say about infection, the priority is saving life.
Saving life, yeah, of course.
Secondary is when we talk about infection.
So it is not like the normal operation theater.
Yeah, it is not at all. It is not
Because
at all.
in the normal elective operation theater or any specialty, the infection control is given topmost priority.
That is given the topmost priority.
Because there is no that much threat for the life of the patient.
Yeah.
So here the thing is, you are telling like 2 to 3 seconds, or maybe even a couple of minutes.
Yeah.
Anything could be happen to the patient.
Anything to.
So if we are worried about the infection control, we couldn't able to save
the life. Yeah. If you are strictly on infection control, we have to change the dress of the patient. We have to clean the patient and all these things. When this all the steps when we complete, it will take more than 5 to 10 minutes.
For a better understanding and a simple understanding of the viewers, could you explain it with an example?
Yeah, there are many examples. One example I used to say that a patient has been admitted in the triage, and the patient fall from second floor of a building that he was doing in a construction
work.
And iron rod that has been placed through his legs, and it has been came through this abdomen, and it was being borne out to this shoulder area.
Okay.
So the thing is that the patient, they have been checking, and the vitals has been falling down, and they are able
because it could penetrate all of the major internal organs maybe.
So they took that patient into the triage, and we got an intimation. As soon as we get the patient is being admitted in the triage, we get the intimation that prepare the OT for emergency. So we will be ready with at any time when we get the information, we'll be ready for a surgery.
Okay.
And when the patient has been shifted soon to the operation theater, and within we can say that we started the procedure in 3 minutes.
Okay.
That is one of
that's too much fast actually.
Yeah.
Because it couldn't be happened in normal elective surgery. One more question over there, like whether if a situation, because the normal people won't know this thing, so some sharp object have been penetrated inside your body. So there is a doubt, like we need to remove it, or we need to wait till the proper help, or like the patient could be shifted to the OT. After coming to the OT only we need to remove the sharp objects, or it depends?
No, actually,
if there is a stab injury, means somebody, because here it is different, it is a long rod. Okay, so it couldn't be removed as such. Anyway, I don't think like the patient need to first to be shifted to the OT, and then
that's a good question. Recently also we got a patient of a stab injury with a sickle that has been on the back of that patient.
Okay.
The ideal thing is that we should not remove that.
Ideal thing is at any time we should not remove
that. If you are removing again, that may cause damage. We are not aware that what is that edge or how where it is pricked.
Okay.
So sometimes if you are removing again, then that may cause
Okay, if
damage.
somebody have seen, like as you have that much experience in trauma and emergency, somebody have seen someone and need to really help that person with a stab injury. So some knife or something pierced inside the body. So what are the initial things? So before going to the hospital, there could be bleeding from that side. And what are the initial things that we need to do or not do?
And the initial thing is that we have to secure that patient. Mainly, the ATLS protocols has to be followed. That is, it's a common thing. ATLS protocol, how to save for the breathing airway, everything that has to be secured. Next, we have to control the bleeding,
Okay.
and also we have to make that item should not be displaced from that area.
Okay. So
may
we need
cause
to
any injury.
restrict movement on that area.
Yeah.
Right.
All the patient completely should be immobilized.
Yeah. So means if it is the affected area is the abdomen, then we need to, there is a position, actually we need to follow, right, the position of the patient that we need to keep on, right. So if it is an abdominal injury, we need to be, make the patient sitting or lying in a position, in a prone position, not in a, normal position, normal supine lying position. But what about something on the back? Means if there is, like you have told, like the sickle knife injury on the back.
Actually, when we say about any stab injury, we will be able to identify that where the exact location it has been happened. But the question is more relevant to when it happened to an traumatic patient of an accident patient.
Okay.
They will be having a multiple injuries.
Multiple injuries.
That type of patient is very much risky patient. There is a chance of spine injury.
Okay.
So always we have to make that patient the position, what position he is being affected, to make that position itself.
There it comes, like we need to seek the help of professionals who could make the patient on log roll method and on spine board and all these things. So that
always whenever the patient is a accidental case, you have to shift the patient in a spine board or
spine board. Yeah. So if the patient, if there is a patient have seen by a common man, layman, and he doesn't know, so at least he could call the professional help like ambulance. And
actually, that is may not be possible at every time to calling a professionals and while the time reaching. The main thing they will be doing that immediately they will be shifting to the nearest hospital. Okay. And the thing is that the golden hour of an accident after the 1 hour is said to be the golden hour. As soon as the patient is received in the triage area or the emergency, we have to initiate the step for saving the life of the patient. So that is the basic thing that will be. So for that, we will be, if any surgical procedure is needed for that particular patient, we will be doing all these things.
Okay, so do you have any, any general instructions to the public? Those who are the viewers and also the public. So in cases of an RTA, what are the things that you could do to save the?
Actually, when I am talking about the emergency operation department and the RTA, the patient will be the bystanders or the person coming with the patient. Once they take the patient and shift inside the OT, they think that everything is safe.
Okay.
And we also, even a common people think that the patient has been shifted to the operation theater, now everything is safe. Okay. But that is not the situation.
Okay. There could be some chances of head injury?
Not only head injury. The thing is that when a patient is shifted to the operation theater in an emergency OT, the 99% the life of the patient in a risky stage.
Okay.
When comparing to a normal surgery, that is just opposite.
Okay.
The risk of the life of the patient's risk is only 1%.
Okay.
That's the thing different.
Okay.
So the thing is that we are answerable to the public, and we are more responsible for giving life of that patient. Okay. And the main thing is it's a teamwork.
Yeah.
It's not only a single person's work, the effort of doctors, the paramedics.
So the patient attendants need to anticipate, like if the patient is in trauma and emergency operation theater, then there could be 90% chances.
Like anything can be happen at any time. Okay, the people or the expert people are trying to save his life.
Okay.
That's the main motive. Anyway, the death should be prevented. Okay. So
first priority to prevent the death of the patient.
And the patient bystanders, the thing is that we have to give a counseling, or we have to give proper instruction what is happening over this.
Because those who are working inside the trauma and emergency department, I don't think like they have a sufficient time to counsel the patient. Is it so?
Actually, we work as a team person.
Yeah.
Now, anyone who is having a communication with that patient bystander, they will be giving a basic knowledge what is happening over there.
Okay. So it is always it should be provided.
Yeah, it should be provided, and we used to provide.
Providing.
And someone will be arranged for give a better communication. And even we can say that the security staff who is standing over the gate, he is more aware, and we will be passing the information even to him.
Even to
So
okay.
when the
So all
staff
the
is not
people
able
who could support on that situation, we are passing information to them so that they could pass the information to the patient attendant, so that they could anticipate like this is a risky situation.
risky situation.
We need to be very calm and the patient, because there are so many times like in the trauma and emergency, the patient attendants are on, there could be some problems like they will set on violence when something happened to them.
And one more thing, one of the difficulties I have been faced, that sometimes the patient may not be willing to do a surgery.
Even on this critical situation.
Even on this critical situation, they will be having some, because they may think that if they do some surgery, something may happen to that patient. So sometimes they will not.
So is it with the patient or patient attendants? Both.
No, patient may be almost in this type of situation. The patient may be in unconscious stage, and maybe with the patient attendants.
So is there any better option for them, like other than that?
We can. The thing is that we will not be having much time.
Okay.
The decision should be fast.
First. Okay.
Because it is we are playing with the life.
Okay. Because the decision anyway depends upon to the patient attendant. It's fully their freedom.
Yeah.
Like whether they need to treat in one institution or not.
No.
Or whether they need to take the patient to any other institution or to home, it is totally up to them, right? But the delaying process can affect actually the quality and even so anything happen to. So it should be quick, right?
The decision should be taken quickly. And the thing is that we can give a proper counseling for that patient by.
So the first thing that you will counsel will be like whatever the thing like your patient is on a critical situation and he really needs help, and your decision, it's upon your decision, and if the decision is soon, then it could save the patient life, right? Like that.
Yes.
Okay. So that could be the main part of the counseling, like.
Yes.
So any other thing that
some more thing is that we can, if the patient bystander, they are not able to pay the affordable for that major surgery. So suppose they had to put some stent or some other implant should be there. So they may not be able to afford for that.
Okay.
So while that time we can do basic procedures.
Basic first aid.
Basic, not even first aid, basic surgeries we can do with that minimal invasive procedures, or we can able to sustain the life of that patient. So we'll get some time.
Sometime, okay.
Okay. So
the time could be extended.
So
that the patient attendant
so the
get
important
some time.
thing, the important part of the surgery can be done during that emergency situation. And
Right.
one more thing
so
is that
stopping about the bleeding and
arresting the bleeding and everything. And mainly when we say about emergency surgeries, the emergency surgeries will last only 1 to 2 hours. Emergency surgeries will not last for many hours.
Why so?
Because
if it is a head injury or something like that,
it's a head injury. We are in emergency situation. We are trying to just save the life. And
okay. So it is not an elective surgery.
Yeah.
So whatever happens,
real emergency, what should be done, that
should be done on the
first period. And after that, we will be getting time. After 24 hours or after 48 hours, we'll be because in a human body, we have to analyze many things and we have to proceed.
Yeah.
So in that initial stage, in emergency.
So if the patient is having an RT and a multiple fracture at that condition, so what would be on the emergency procedure? So if there is a multiple fracture, having fracture to the bones, like on the upper limb and lower limb, okay, like femur bone. So it is a big bone as well. So is it possible on the emergency surgery, like we could fix all the fractures, or it will do like so the main fracture need to be settled at that time?
The thing is that which endangers the life of that patient, that is matter. So that should be corrected first.
Okay.
So
if it is corrected, then we could leave the patient for another surgery for another time.
another
Right?
day.
Okay.
So almost all the emergency surgeries what we have in the patient anyway, they'll be undergoing 1 or 2 surgeries after that, after 1 day, 2 day, or 3 day, or after 1 week.
So there could be a series of surgeries.
Series of surgeries. At least 2 to 3 surgeries the patient admitted in trauma department will be undergoing.
Okay.
Because it is first is saving the life, later restoration and safeguarding, like that. The
And one
procedure.
thing I have noticed, like in some RTA, so there is like the patient coming with head injury, but the patient will communicate with the patient attendant and all. So many of the patient attendant will complain. In most of the institution, they will complain like, my patient was very well when we reached the hospital and all,
Yeah.
but after some time, suddenly he have got deteriorated and have got it
Okay.
like the demised like that. So there is this complaint which is prevalent in most of the institutions.
Yeah,
actually.
mainly that this type of things will be the things that after RTA, in body there will not be anything changes.
In the
If there is-
outside.
outside. If there is a fracture that is visible,
Hmm.
they will not be able to move. Because the internal, if any bleeding, they will not be able to identify. Only expert people are able to identify.
Okay.
Okay, so till the patient was admitted in the hospital, he was okay. He may be coming by walking. So after that only the condition is deteriorating.
Okay.
So that type of situation occurs. Many of the times that we have to educate to the patient, or we have to communicate to the bystander that this is happening. If you are giving proper communication that this is happening when you came, this is the
This also could happen actually. There could be some internal bleeding.
Actually, it may happen even after 1 or 2 days of accident also.
Accident also, yeah. Because it could be, there couldn't be any signs actually internally. There could
Actually, there will be signs, but they will not be analyzing that is happening.
Okay.
Okay, acidosis may come. Okay, then the body, the various functions of the body will be not able to manage.
Okay.
Because we have seen some of the patients in the triage after admitted while walking, and after in few hours the patient condition getting deteriorated and the life is going. That
Anyway, for all patients, I think there will be neurological examination had to.
or whenever the patient is being admitted in the triage, they'll be having a whole body examination will be there. They'll be having a thorough examination will be there. And this is the protocol that is guided by the government of India will be following. And we used to get some of the patient that is unknown patients we used to get. So the police people will be bringing these type of patients.
Okay.
So everything we used to use the same protocol. So
Okay. In neurological examination, most of the signs and symptoms or whole body examination, it is possible like most of the signs and symptoms which is visible that we could identify and we could help the patient. But there could be chances like some of the.
The thing is that when we are not able to identify, we have some of the, then we will be referring for X-ray or for MRI or CT. Suddenly it will be happening.
Okay.
So there will not be much delay.
And if the patient have a loss of consciousness or something like that, then only we will look for MRI or CT.
No, that's not needed. Whenever, according to the cause of injury and where the injury is being happened.
Yeah, after the injury, I'm telling like after the injury, and the patient is experiencing LOC, loss of consciousness or something like that.
That will be identified in the triage itself. According to the basic investigation will be, there will be doctors will be able to identify what to be done.
Okay.
So the thing is that we should not miss any of the investigation area.
Okay.
That may cause endanger the life of the patient.
All right. So, and what is your experience in working as a team, as a nursing administrator in trauma and emergency department? Because the time period is limited to build up the team. What about the effective communication and all these things?
The thing is that the time period is very much less for starting a procedure and for doing that procedure. The thing is that we should not make any mistakes.
Okay. So whether you think like on the normal setting, you could coordinate and communicate well in the team. But what about in trauma and emergency where everybody is busy?
Everybody is busy, but the thing is that the work should be happened in the same manner it should be, how it should be.
Okay.
The thing is that when you are doing a procedure, the main thing, the nurse should check that instruments count.
Okay.
So what are the things that is used? That should be documented properly.
Okay.
So while starting the
on a short period of time, everything should be, do intact, means like that.
It should be fixed. It should be there should not be any change in that.
Yeah.
So if there is any change, that should be documented.
Okay.
So we have fixed for every protocol. So for every instruments, we have a fixed protocol that what all the instruments should be having in that set, which set it is opening.
Okay.
It should be pre-count and it should be packed. And if there is any change, that should be immediately
It's
documented.
a thorough inventory, like inventory also after
Inventory before the surgery and during the surgery, after the
after
surgery.
surgery.
So everything should be, and not only doing the instrument, what all things that is being given to the patient, what all the counts, everything should be. And also we strictly follow this WHO protocols.
Okay. So there is a guidelines from WHO that you should follow. These are guidelines on all institutions.
It is one of the surgical safety protocols.
Yeah, surgical safety protocols and a list of instruments, countersigned with nursing officers and also the in charge and also
So
the
after
doctor and physician.
every surgery, I will be going through the instrument checklist, and if there is any missing or any changes or alternation, then I'll be again going through that what has happened for that, and again I will be checking, recheck what happened for that,
Right.
like that.
Okay. And what is your leadership style like as a nursing administrator?
As a, I used to, according to the situation, I used to change my leadership style. Actually,
So because I have heard like you are very supportive administrator from your colleagues like that.
maybe according to the situation, it may
Because
change.
so I thought like more or less it should be like a supportive supervision whenever there is a need, like this thing needs to be done like this. You just need to support the nursing.
And sometimes I used to delegate some of the works to them, and I used to supervise. In sometimes I used to, like a democratic way, I used to ask to them what should be done, because they are the working people. So the difficulties faced by the people, they will be more able to analyze what is the difficulty is. So when I am doing that job, I will be able to know that what is happening.
Yeah, a good leader always needs to listen to the colleagues actually. Like
And then one more, some of the thing is that always we should be a good listener.
yeah.
You have to listen what is happening and what is occurring, because according to the situation, the staff may also be, they may get more anxious, and they may start doing something wrong or like that. So we should
because when they are in tension or too much stress, then there could be something wrong could be happen like that. It's
so I used to silently I used to listen, and I say idea or any
possible solution.
Sometimes they will be very much stressed and they will be speaking. I used to and just sit down and say me what is the problem. After completing all this problem, then I'll say okay. So they'll not be expecting that answer from me. They'll be expecting something. When that problem is put to me, I will also to that higher range and something is going to happen. So I used to.
So there is a provision to ventilate their stress like that.
Yeah, right? Actually the thing is that almost every people in that emergency situation in a high tensed area, because the only priority in front of us is to save the life of the patient. So every people, according to the job responsibility, they need the work to be completed. Suppose if they want an USC to be done, suppose we are not having a USC mission, the priority is they have to get that USC mission.
We need
if
to
some delay in that, if something delay is happened, they will be in much stress. So the same way, if some surgical instruments is needed, we are not able. Sometimes the set may be in the CSSD for autoclaving. So we should have an alternative plan. What can be used or what should be
plan B.
Always we have a plan B. Always we have a plan B. What happens then? What should be done?
So it is highly a tense situation.
Always it is a tense situation. The thing is that we have.
There couldn't be any funny moments at work like that.
We have many of the funny moments in the between. We used to have birthday celebrations and all the doctors.
Whenever the rush is low and all these things.
No, but sometimes a few days before the person who is having birthday, he was doing surgery. He was a scrub nurse. We were celebrating his birthday and we were cutting the cake because he was not able to participate.
In place of that person, you were cutting.
We were cutting the cake, and he bought some sweet packets for everyone. So doctors who is becoming free, they will take. This is something happening.
And it is actually needed as well in workplace. Like
the thing is that we in other places we'll be having a get together all the time, but
It is not that much possible in trauma and
Yeah,
emergency.
it's not possible. According to the situation, we used to
Yeah.
celebrate and everything. And also, our HOD is also very much, he is always cooperative and, whatever, supportive. And also, if some mistakes we have done, he used to identify and we used to correct it.
Okay.
We used to say that this is not the way or this is the way. So, that type of guidance.
Always a corrective guidance.
Corrective guidance. That is also motivation for us. Sometimes if they're saying that you have done this wrong and you are no, worthless like that, if they are giving like that comments, then that also mentally that we also will be in a stress and we will not be having that mentality to work.
Yeah.
So,
but it is not like that. It is always supportive.
Always it is supportive, and from nursing side also it is very much cooperative, and they are doing much good support for us.
So trauma and emergency is a place we have the provision of all the things like that. There is a lot of things to learn.
Thing is that we are taking the patients between life and death. Yeah. It's just a narrow.
And it is a very responsible duty as well. Like working in a trauma.
Even a small mistake of us can lead the patients.
Okay, so everybody working in trauma and emergency, they are very crystal sharp, I think. Working as well.
That may not be, because we used to get a staff of all type. There will be trained staff will be there.
No, whoever is experienced and trained, so they will be very sharp and focused.
Everyone who is coming through this process, they will be modulated and modified to according to that situation. Okay. So we are giving that of training. Okay. And who have been working in these areas, they will be.
And I think trauma and emergency needs much more orientation than any other department, just because of its importance to save the life of the patient.
Yeah, right? Life of the patients. When comparing with other departments, really we are giving some affect to that patient, because after some of the procedure we used to see some of the patient in the ward on the recovery areas, because we may think that the patient will not survive. So after the surgery also we will not be having that confidence that much we have done, but what may happen to that patient. But some of the patients, after some of the brain surgeries, we used to see that the patient is singing and walking. That type of situation we have.
That is a blessing vision actually, right?
Because the surgeon used to share that picture when the patient has been in the ED, what was the situation, what was the picture, and after that, when we realize that become so happy. So that type of, so we have given, because of our efforts, some of the life has been changed. Yeah. So these type of things happen.
So if we are saving one life, it couldn't be one life actually. The whole life of the family actually, because he could be the breadwinner of the family, right? Oh, so it's really amazing.
And in some situation we may be helpless also. Suppose the patient may be, his life may be,
because it couldn't be on our hands. Like it could be beyond our capabilities and all the things, because it could be almost late to do any intervention like that. Okay, all right. Okay, so it's a lot of information, and also, so other than your profession, what are your, out of the profession, what are your hobbies and how?
Actually, my personal hobbies, I used to, usually I'm a busy person. Okay. So some type of work will be there in the home, means will be with home rearing, and some work will be there. When I come to duties, I'll be engaged with duty hours, I'll be busy. And some of the, I've been working some of in association.
Association. So you are the Nurses Association president, I think. So how you feel like,
it was an opportunity given by my colleagues and all the people who have been elected. There will be some of the responsibilities, because I am representing on behalf of them.
So because I think your hobby is taking the challenges and responsibilities like that you have made. You have habituated your hobbies like that, I think.
Yeah, many challenges is that we have to do some work on behalf of that people. And according to the administration situation, we have to behave. Okay. We cannot, for all the things, we cannot go and fight for it. Oh yeah. Whenever situation we have to plead and get it. Okay. So according to the situation, we have to get it. The thing is that the work should be done.
Okay. That's the topmost priority.
The goal is that anyway the work has to be done.
Has to be done. That's the topmost priority.
So we have to modify ourselves, and we have to be silent and cool. And when we get the opportunity, we have to get the work to be done.
Wow, it's a visionary thing, like for any leader like that.
Yeah.
Okay. And yeah, that's anything that you need to add.
The thing is that whatever work it is being assigned to you, you can do your work, you can complete the task, and slowly you will be you will be achieving the success.
Okay.
So
So we need to be patient actually.
yeah,
That is
always.
the takeaway of this episode is like you need to be patient, you need to work hard, you need to work steadily as well to achieve a particular goal in your life, and you will be succeeded anyway.
Yeah. The thing is that the protocols or any rules that should not be compromised.
Okay.
That even the tiny shortage, we have to modify according to that situation, and we have to complete that task
Complete disaster. So the work should be done on time.
on time.
That's the main thing. All right. Okay then. So it's a visionary, and it have so much experience that Renish sir have shared for the viewers, and there is so much motivation for the future nurses, student nurses, and all who is planning to work in a trauma and emergency department and also the operation theater. Okay, Renish sir, thanks
Okay,
for
thank
coming.
you, sir, for giving this opportunity. And one more thing, I have to conclude that what all things that has been done, both these procedures. So we don't have in nursing, we don't have a written protocols of these surgical surgeries or what are the steps that should be followed.
Okay.
So no books is there.
Okay.
So there is the people lacking for this type of knowledge.
Okay, is there any solution for that actually? Whether it could be made like in
Yeah,
a systematic
it
manner?
can be made for what surgery, what procedures, for what are the sets needed, what are the steps of the procedures. So these type of things has not been added even in our curriculum.
Oh,
So this
that's a new knowledge. I think need to be this thing need to be taught by some of the nursing authorities.
administrators.
In actually, like the authorities like the Indian Nursing Council need to add in the curriculum. Like for this surgery, what are the steps? So we have some medical textbooks referring like there are steps for this type of surgery, even microscopic surgery. These are the steps needs to be followed by the medical person. But there is not such book which is telling like the nursing personnel how to make it much more systematic and what are the steps like that. So yeah, that's a great thing, that's a great idea to be shared actually. Okay.
So if somebody listens and somebody plans to do that, you can.
Yeah, this could be motivation for the upcoming and also those authoritarian personnel in the nursing, those who are need to take initiative on this thing because this is an important point to be covered. If there is a written document guidelines like for this type of surgery, these are the nursing steps. Like these are the instruments on this step, these instruments will be in use, and also we need to assist in such a way, then if it is possible, then it would be all good. And it could, it could make the standards, nursing standards, and also the quality that is provided by the nursing professionals who is assisting in the operation theater, it would be a fantastic thing to do. All right, and thanks for watching.
Thank you, viewers, and also thank you, Picment Studio, for giving this opportunity.
Thank you so much. Have a nice day.